So, what is necrosis? Necrosis is a pathological process that is the consequences of severe injury. The main causes of necrosis include loss of oxygen supply, microbial toxins, injury, trauma, in which the proteins leak out of the cell, damaging the surrounding tissue. It is always a pathological process because of irreversible cell injury. What are the main key features of cell necrosis? Here, the cell swelling because of plasma membrane rupture, leakage of the cellular content, and these cellular content which leak out will cause inflammatory reaction, and these inflammatory reaction causes enzymatic digestion of the tissue, leading to fibrosis in the further leading to healing and fibrosis. There are basically five types of necrosis, but we'll remember six types of necrosis like coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis, and gangrenous necrosis. Now coming to the coagulative necrosis. Coagulative necrosis, dead tissue retain the architectural outline for several days. Here, the cell outline preserved for a day. In the nuclei, first karyolysis will happen, then karyorrhexis, then karyopyknosis. Here, the eosinophilic anuclear cell on microscopy can be seen. The inflammatory reaction at the periphery will be there. So on microscopy, we'll find eosinophilic dead cell and it will be preserved outlines. The main clinical causes of coagulative necrosis can be seen in ischemia, infarction of the solid organ, heart, kidney, and spleen, except brain, because in brain liquefactive necrosis take place. Liquefactive necrosis, the dead tissue is digested by the enzymes that results in a liquid viscous mass. There is a complete digestion of the cell. Grossly, we'll see soft liquefied area, and on microscopy, no cellular outline will be there, only amorphous debris. It will be seen in case of CNS infarct, bacterial and fungal infection. Now coming to the caseous necrosis. In caseous necrosis, tissue appear like a cheese-like, soft, granule, friable. On microscopy, granular amorphous material will be there, but without the cellular outline. The extensive cell wall lipid form macrophages surrounded by a granulomatous inflammation. It is typically seen in tuberculosis, Mycobacterium tuberculosis, but can be seen in case of fungal infections like cheese-like appearance will be there. Granular amorphous debris will be seen. Caseous necrosis. Now coming to the fat necrosis. In fat necrosis, there is a destruction of the fat cell, usually by the enzymes. What enzyme? Lipase enzyme. It will be seen in case of pancreatitis. Grossly, we'll see form chalky white area. This chalky white area is important. On microscopy, we'll see ghost outline of the fat cell. Here, the enzymatic breakdown of triglyceride take place. The fatty acid combined with the calcium and lead to saponification. Okay, it will be seen in case of acute pancreatitis, trauma to the breast tissue because breast also have fat, and post-surgical fat necrosis. These fat necrosis can be seen. Now coming to the fibrinoid necrosis. Fibrinoid necrosis, necrosis of the vessel wall with the deposition of fibrin-like material. Microscopically, we'll see eosinophilic amorphous fibrin-like deposits in the cellular wall. Here, loss of normal vessel structure architecture will be there. It will become light pink color. Mostly, it is seen in immune-mediated vascular injuries like vasculitis, malignant hypertension, SLE. These all cases. Now, coming to the gangrenous necrosis. It is not a single entity in the necrosis. Here, dry gangrene will be superimposed with coagulative necrosis. Wet gangrene is because of Clostridium bifrensis. Dry gangrene will be seen in diabetic foot, like it will become very black in color. Wet gangrene, swollen, foul smelling will be there. Okay. Microscopically, we'll see coagulative necrosis plus bacterial invasion. Now, how to differentiate between it is necrosis or a apoptosis? Remember, necrosis is an uncontrolled cell death. Apoptosis was a controlled cell death. Necrosis, here the membrane rupture content leak out, causing inflammation. Okay, and it is always pathological. Necrosis is never physiological, unlike apoptosis. Apoptosis can be physiological as well as pathological, and the hallmark of apoptosis was there is the membrane was intact there, so no inflammation in case of apoptosis. This was full necrosis in a single page. We'll remember the causes of apoptosis with the mnemonic HIT. HIT is like hypoxia, ischemia, trauma, and lots of A are there from this A. Autoimmune, that is fibrinoid necrosis. We'll remember this. To remember the type of necrosis, we can remember 2C, 2F, and LG. 2C, caseous necrosis, coagulative necrosis. 2F, fat necrosis, and fibrinoid necrosis. LG, liquefactive necrosis, and liquefactive necrosis and gangrenous necrosis. Remember some histological findings also. In coagulative necrosis, we'll have ghost cell. In coagulative necrosis, we'll have ghost cell. In liquefactive necrosis, we'll have lots of neutrophils plus liquid debris. Okay. In caseous necrosis, we'll have granuloma on microscopy. On fat necrosis, we'll have chalky calcium deposits. In fibrinoid necrosis, we'll have lots of eosinophils around the vessel wall. Gangrenous necrosis, bacterial, dry gangrene, liquefactive, and gas. These was the important point about the necrosis. Now, answer. Why is brain infraction liquefactive? Remember, because of high lipid content and abundant hydrolytic enzyme that causes the complete digestion of the brain tissue, leading to liquefactive necrosis. Why in heart we have coagulative necrosis? Because of protein denaturation predominates here, and it also lead to the preservation of the architecture of the tissue. Why gangrenous necrosis is not a true type of necrosis? In Viva, they can ask you. Remember, it is a clinical description. Microscopically, it is coagulative with or without liquefactive changes. Which type of necrosis is seen in TB? Caseous necrosis. Caseous necrosis is seen in TB. Which necrosis is associated with acute pancreatitis? That is fat necrosis. With fat necrosis is saponification. Coagulative necrosis, heart. Liquefactive necrosis, brain. Caseous necrosis, TB. Fat necrosis, pancreatitis. Vessels may fibrinoid necrosis, limbs, gangrenous necrosis. So, this is necrosis in a single page. If you found this revision helpful, save it before your Viva and share it with your study groups. Follow Pathology Collection for more Robbins Simplified one-page revision. Thank you.